The Department of Cooperative Governance and Traditional Affairs in KwaZulu Natal says environmental health practitioners are on the ground in the lookout for any waterborne diseases. Now, the World Health Organization says there are 6 diseases or health problems that are worth looking out for during flooding. Now, let's discuss this further with the head of the Center for Enteric Diseases, Dr. Juno Thomas. Doctor, thank you so much for your time. I wonder, as community members are picking up the pieces to try and rebuild and move forward, what diseases would, environmentalists who are on the ground right now be looking out for that you would say are of great concern?
Good afternoon to you and your viewers. I think always following major flood disasters, the concern is around diseases that can cause catastrophic outbreaks. And the most important of that is cholera. There have been catastrophic outbreaks following floods in many parts of the world. And because cholera is endemic in South Africa, it's always a risk. Other diseases that can cause outbreaks following floods include typhoid or enteric fever, and there are many other types of diarrheal diseases like shigellosis and also enteric viruses that can cause disease following floods. Another important infection that often causes diseases following floods is something called leptospirosis, which doesn't present with diarrhea like cholera would, for example, but it does cause quite a bit of illness. And generally, people do need to be treated for that infection.
And for someone watching tonight, what symptoms should they be looking out for if there's any concern at all, if they're finding themselves in a vulnerable position?
So obviously, any diarrheal disease, diarrhea with or without fever or vomiting or abdominal pain should be taken seriously. Other diseases like typhoid or enteric fever can present without diarrhea. And enteric fever presents very much almost like a flu-like illness, particularly with fever and other non-specific symptoms like headache, malaise, and you can get some abdominal pain and sometimes constipation or diarrhea. But anyone with a severe fever who's feeling unwell should go and see a healthcare practitioner. But diarrhea needs to be taken very seriously, as does any severe fever.
Pardon me, Doctor, there. What would you say is the reason that we see these diseases spreading faster, particularly in situations like these ones?
So typically with flood disasters, there's major damage to water supply and sanitation and sewage infrastructures. And this allows contamination of the water supply with organisms that can cause outbreaks, like, for example, cholera or typhoid fever. Often there's a delay in getting the water supply and sanitation infrastructure repaired, and also in supplying water, safe water and sanitation to areas where flood victims are now being housed. And usually these are emergency situations where you get overcrowding, and there are often issues there with trying to maintain optimal hygiene standards due to lack of safe water supply and optimal sanitation infrastructure.
Are there any preventative measures that residents can take at this time?
So the most important measure is to ensure that you have safe water. So if you aren't sure that the water supply that you're using is safe, then you need to make it safe before you use it for cooking or for drinking. And you can do this either by boiling the water for a minute and then letting it cool, or treating it with household bleach. And you use 1 teaspoon of household bleach to 20 liters of water, stir it, let it rest for half an hour, and then it is safe to use. So apart from safe water use, People also need to make sure that they are being very careful around food safety. And, for the rest, I think, it's generally going to a healthcare facility should they develop any symptoms of diarrhea or febrile illness, and rather get it seen to timeously.
Doctor, how important is it also going to be for authorities to check or even test the water that is delivered to residents in tankers?
So water that is being delivered to residents in tankers should be tested and should adhere to, there's a standard of criteria for which water should be tested against to know that it's safe from a microbiological and a chemical point of view. So that should be standardly in place. It's where you have water that's being used from other sources, like, for example, rivers or for example, wells or even boreholes that might have been compromised as a result of the floods and that you might have sewage contamination in. That will have to be tested before use, and in fact should be treated anyway before use.
So listening to what you're saying is that the testing is going to be critical to ensure that there is no contamination even in those tankers.
Yes, so that water should generally, as a rule, be tested before it is delivered for use.
All right, Doctor, thank you so much for giving us those insights and tips for some of the residents watching tonight on how to navigate these difficult times. Thank you. We do appreciate that. That was the head of the Center for Enteric Diseases, Dr. Juno Thomas.
Now let's look at